Welcome to Home Care Matters, the show where we discuss all things home care, with discussions on important age-related matters and topics. Brought to you by Enriched Life Home Care Services, the #1 rated home care provider in Michigan by Top Rated Local.
Hello and welcome back to All Home Care Matters. If this is your first time visiting us here at the show, thank you for taking time out to be with us today. We appreciate how valuable everyone's time is, and that's why we try and make each episode here at All Home Care Matters something that will hopefully matter to you. Today's episode of All Home Care Matters is for the family caregiver. We're going to be discussing 10 tips for you, the family caregiver, to help you provide better care for your loved one and to take care of yourself. Did you know that currently there are 65 million Americans caring for a loved one who is either disabled or in failing health? Of those 65 million caregivers, 2/3 of them are women, and according to the AARP, there's approximately 34.2 million Americans who are currently or have in the past provided unpaid care to someone over the age of 50 years old in the past 12 months. Maybe you are one of those caregivers that have had to give up their job, or maybe you've had to sacrifice something else so that you could be there and care for your loved one when they needed you most. If you have, we appreciate and understand what you're going through so that you're able to be there for your loved one when they need you. And we hope that today's episode helps you and helps your loved one. The Caregiver Action Organization has compiled a list of 10 tips for family caregivers. And after we go through the list and discuss these tips that they have provided, we'd like to hear from you and know if you have tips that we didn't discuss that have helped you as you care for your loved one. On our website, allhomecarematters.com, there is a private secured form that you can fill out to share your tips with us. And we will be doing a follow-up episode in the future to include your tips and suggestions. Being a caregiver for a loved one can feel isolating and leave you feeling like your friends, peers, and coworkers don't get it or understand what it is you're going through. We have someone who attends one of our caregiver support groups who said once that one of her coworkers told her that she needed to stop being so dramatic and that there was no way that her mother was so difficult to deal with. The problem was her mom did require a lot of her daughter's attention and help. She had moderate dementia, and at night she wouldn't sleep and would wander around her home all hours of the night, and she was convinced that there were strangers having parties in her den and family room, which led to her every 15 to 20 minutes going to get her daughter up and making her go into those rooms and turn the lights on and relock the doors over and over again so that she could have peace of mind. But then it would start all over again 15 to 20 minutes later. The daughter was frustrated and hurt and even angry that her coworker would suggest that she was just being dramatic. The problem is her coworker had no basis or understanding for what this daughter was going through day after day, while also trying to keep her job so that she could continue paying her bills. This leads us to our very first tip, and that's seek support. Seek support from other caregivers. Having a support system around will help you when you're having a rough day, or like this daughter, you'll have others who have gone through something similar, or perhaps they're going through it now, so that you won't be left to feel alone. Tip number 2, make your health a priority. If you've been to caregiver support groups before, or heard this on one of our previous episodes, this is something that you'll hear over and over again because it's true. And that's, if something happens to you, who will care for your loved one? It's easy to neglect your health as you remain focused on your loved one and their needs. That's commendable and understandable. But don't neglect or ignore your health. You need to stay strong mentally, physically, and emotionally for your loved one and for you. Tip number 3, accept help. I'm sure most of you have said to someone at some point, if you need anything, let me know, or can I help you with anything? When someone says that to you the next time, take them up on their offer. It's okay. When you get time, make yourself a little needs list of things that someone could do for you that would make things a little bit easier. Don't let yourself feel like that's being selfish or neglecting your duties or responsibilities. Nobody is Superman or Superwoman. Everyone needs help, and when you're caring for a loved one, that offer from a family or a friend is a good way to lighten your load, even if it's just a little. Tip number 4, communication. Oftentimes, when a family member is suddenly found themselves being thrust into the role of caring for a loved one and becoming a caregiver, they aren't always medically inclined or experienced. This could be not only with procedures like giving a bed bath properly and effectively, but also with terms, phrases, and medications. If you aren't sure about something or understand what a doctor or a nurse has said or explained, don't be embarrassed to tell them and ask for it to be explained in a way that you can understand. Medical professionals are typically very understanding and patient with family members and with helping to make things for a more plain and easier way to understand. Tip number 5, take time for yourself. Even if it's just for a quick break, make sure that you find and schedule personal time for you. This also ties into your health as well. There are options if you aren't able to find a family member or a friend who can give you that respite that you need. If that's the case, you can try contacting a local adult day center in your area to see if they have a respite program or a drop-in service. Now, if you do explore this option, just be aware that adult day centers have prerequisites for those who can attend. And if your loved one doesn't qualify, or if there isn't one in your local area, home care providers are also another option that is worth exploring. Tip number 6, technology. Technology can be a useful tool and resource for you as you care for your loved one, whether it's playing their favorite music to help soothe them or help them to go to sleep or to change their moods. Or maybe you're finding games or coloring activities to help stimulate them. There are many wonderful options that technology offers, and many at a very low fee and in some cases even free. Tip number 7, make sure to have all their medical documents and their medications list up to date in an easy to find location. Having these documents at your fingertips and readily available can help eliminate the pressure and stress of having to dig for it every time there's a new doctor's appointment or some other medically related appointment or need. Tip number 8, make sure that all legal documentation is in order and up to date. If you need to help with banking, bill paying, or signing documents for your loved one, you'll want to make sure that all of their legal documents and affairs are current and up to date, and that you have the proper authority if it's needed to act or sign documents on their behalf. Tip number 9, make sure that you give yourself the credit that you deserve and stay positive. There will be days where that's easier said than done, but just remember, you're doing the very best that you can. Tip number 10, making sure that any supplies or medical equipment that you're using frequently is stocked and available. There is few things worse than needing a pair of gloves or a new brief, and when you go to get them, you find that you're all out. Make an inventory of what you need and what you have and what you use so that you can start to gauge how much supplies you're using and try to get a small stock of these in your supply closets. Now, we want to thank all the family caregivers who are giving of themselves so unselfishly to their loved ones. We understand and know that these roles are sometimes thankless and underappreciated, and a lot of times unpaid as well. And we want to thank you for joining us here, and we hope that these tips will be helpful to you and to your loved ones. All Home Care Matters is here for you and to help families as they navigate long-term care issues. We invite you to please visit us at allhomecarematters.com, where there's a private, secure, fillable form there where you can give us feedback or show ideas or if you have questions. Every form is read and responded to. And again, if you know someone who could benefit from this episode, please share it with them. We hope that you'll join us next time on All Home Care Matters, where we're going to be discussing difficult behaviors associated with dementia. Thank you so much for being here today.
Thank you for joining us today. We look forward to you joining us again on another episode of Home Care Matters. To learn more about the show and to connect with us, visit us at allhomecarematters.com.